So now we're going to move on to an assessment of the muscle mass. One of the things that I really want to emphasize is doing the evaluation in the position that the dog is comfortable in. It's ideal for muscle mass evaluation if they can be standing in a relaxed way so that you can assess muscle mass from one side to the other. But the most important thing is for the dog to be calm and relaxed. And so I really want to emphasize performing the evaluation in the position the dog is most comfortable in. Okay, so as we start the assessment of muscle mass, I really like to be positioned standing over the dog, really so that I can optimally assess symmetry from left to right. I'm going to start at the top of the forelimbs here. I know that the spine of the scapulae are going in this direction here, and so I'm going to run my fingers perpendicular to the spine of the scapula and make an assessment of the supraspinatus and the infraspinatus, just gently rocking forward and backward like that. And what I'm aiming to feel is that I just want to be able to feel the spine of the scapula. It shouldn't be too prominent, and it should be symmetrical from left to right. From this position, I'm going to run my hands, my thumb down and inside the triceps with a finger on the outside here. I prefer to assess muscle mass ideally with just finger and thumb, because I think that heightens your sense of touch. And sometimes I'll even close my eyes as I'm doing that, because again, that can heighten your sense of touch. I'm assessing the triceps muscle here. You can see the muscle beautifully on Pete here. I'm assessing the triceps muscle at the midpoint on each side. And one thing to remember is that a tensor, a loaded muscle, will feel different to an unloaded muscle. So sometimes as you're making the assessment, you want to just rock the dog from side to side, load and unload that muscle. Again, evaluating those two things. Is there sufficient muscle mass, and is it symmetrical from left to right? From here, after assessing the triceps muscle mass, I then run my fingers over the elbow joint. And this is the first pass over the elbow joint, making an assessment as to whether or not there's any potential pathology there. Whenever there's osteoarthritis in a joint, that joint reacts with periarticular thickening and possibly effusion. And so from this position here, I'm going to run my fingers over the elbow joint in that gutter, that groove there between the lateral epicondyle and the olecranon. And there should be a groove, there should be a dip. If that dip has gone, if you can't feel it, or if it feels as if there's some soft tissue in there, that could be an indicator of elbow pathology, because filling of that groove there is either going to be periarticular thickening or effusion. And again, these things are not definite indicators of joint pathology, but if I felt thickening in that groove, I would certainly come back and pay extra attention to that elbow joint. From there, after feeling whether that groove is nice and empty, I then run my fingers over the antebrachium here, assessing the antebrachial muscles, and then move down to the carpi, making a similar assessment of the carpus as I did for the elbow. If I can feel all the small bones of the carpus there on the cranial aspect, that would suggest that the carpus is normal, because there's no periarticular thickening.